So, give me a second. Let me just read this. So we'll call before we begin, I want to remind the Public Safety Committee members and members of the public to follow our code of conduct at meetings. This includes commenting on specific agenda items only and addressing the full body. Public speakers will not engage in a conversation with the chair, council members, or staff. All members of the Public Safety Committee, staff, and the public are expected to refrain from abusive language. Repeated failure to comply with the code of conduct, which will disturb, disrupt, or impede the orderly conduct of this meeting, may result in removal from the meeting. This meeting of the Public Safety Finance Strategic Support Committee will now come to order. Can the clerk's office please call the roll?
Batra.
Present.
Torres. Kamei. Vice Chair Dwan.
Present.
And Chair Jimenez.
Present.
Thank you.
All right, we're going to move on to review of the work plan, which is item B1, the Gender-Based Violence Annual Report. This is going to be deferred to the May 16th Public Safety Committee. I don't recall if we take public comment here, but to the extent there's public comment on the work plan, is there anyone?
We have no public comment.
Okay. We'll move on to consent. Seeing nothing on consent, we'll still take public comment on consent. I suspect no one's here.
There's no public comment.
All right, wonderful. We'll move on to item D1, which are reports to committee. The first is, and I welcome everyone to come down that's tied to this particular item, Santa Clara County 911 Ambulance Service Status Report and Fire Department Emergency and Medical Service Annual Report. We have Chief Sapien, Battalion Chief Chung. We also have consultants Ed Rodriguez with AP Triton LLC and Tim Mabey with AP Triton LLC. Please start whenever you're ready.
Good afternoon. I am Robert Sapien, Fire Chief, and I am joined today by Battalion Chief and EMS Division Manager Patrick Chung. We also are joined by the firm AP Triton, represented by Ed Rodriguez and Tim Mabey, who are assisting the department with evaluation of ambulance service delivery models and practices. We are here to present item D1, Santa Clara County 911 Ambulance Service Status Report and Fire Department Emergency Medical Services Annual Report. Chief Chung will be leading off the presentation.
Okay, so on October 16, 2023, the City Council conducted its Santa Clara County 911 Ambulance Services Study Session, where the department presented an overview of EMS operations within Santa Clara County, with a focus on the state of ambulance services in the county and its impact on the department operations. Additionally, the discussion included the status of the current 911 ambulance services provider agreement between Rural Metro of California and its pending expiration of June 30th, 2024, with an option to extend for one additional 3-year period. The department offered that the expiration of this agreement would present an infrequent opportunity for EMS system reforms, noting that implementation of other EMS system models have resulted in improved performance, efficiencies through operational integration, and greater sustainability through improved cost recovery.
Currently, in our county, 911 ambulance services are contracted to and provided by Rural Metro Ambulance, also currently known as American Medical Response, or AMR. This is in the Santa Clara County exclusive operating area. A typical EMS response: a fire department unit arrives on scene first to provide patient assessment and treatment. Here in San Jose, every emergency response unit is staffed with a firefighter/paramedic and has the necessary equipment to provide advanced life support, or ALS, services. A rural metro ambulance is also dispatched to each EMS incident to provide patient care with transport to hospital emergency rooms. As previously reported, 911 ambulance unavailability has persisted for some time and has resulted in delayed patient transports and a significant shift of workload to fire departments. The ambulance provider has been unable to maintain adequate ambulance levels across the county. Some factors cited by the county for low ambulance levels include staffing challenges, increased incident volume, and hospital ambulance patient offload delays. Inadequate staffing was a significant driver of ambulance shortages, with the County of Santa Clara Health and Hospital Committee reporting that as of November 1st, 2023, AMR needed 30 additional full-time equivalent paramedics to achieve its optimal staffing level within Santa Clara County.
So one strategy rural Metro has taken to increase ambulance availability is deployment of basic life support, otherwise known as BLS ambulances, staffed with 2 emergency medical technicians, or EMTs, with no paramedic. This strategy has increased the number of ambulances available to provide transport to hospital emergency rooms. However, first responder agencies, firefighter paramedics, have had to absorb additional burden, and fire agencies' resource availability has been diminished. County EMS protocols allow transfer of patient care from an ALS paramedic provider to a BLS EMT provider in limited non-emergent situations. In all other cases, first responder agency paramedics must escort the patient to the hospital in the otherwise BLS ambulance, drawing down first responder resource availability for extended periods of time. So what we're looking at is the red line is department late responses. The blue columns are the number of BLS ambulance escorts that we've conducted in fiscal year 22-23. And we're going to look to a greater snapshot on a 31-month period, basically when we started identifying that rural Metro was beginning to have staffing challenges you see there in the summer of 2022. There's a direct correlation with the number of BLS ambulance escorts that our department paramedics are conducting with department late responses. As depicted in the chart you see before you, ambulance unavailability results in delayed transport of critical patients, extended on-scene waiting times, and extended response times to subsequent emergencies for the department. In an effort to improve ambulance availability, the department has increased utilization of our existing rescue medics. However, when these rescue medics are tasked with transporting patients, a correlation occurs with increased late responses to EMS incidents, as the units are committed during transport, making them unavailable to respond to subsequent emergencies. So similar to the graph previous, the red line is department late responses. The blue columns are the number of rescue medics that we're performing, or rescue medic transports that we're performing, and that's in lieu of the contracted county ambulance provider. If we zoom out to a 31-month snapshot again, you'll see, once again, the department conducted almost 0 rescue medic transports prior to fiscal year 21-22. And when we start seeing rural Metro have some staffing challenges and ambulance unavailability, the department has to conduct more and more rescue medic transports, which directly correlate with our department late responses.
As presented at the October 2023 Santa Clara County 911 Ambulance Services Study Session with the City Council, the department is actively engaged in driving system reforms, including developing a service model that will provide adequate and sustainable EMS resource levels throughout the county that are operationally integrated with fire agencies and that do not compromise fire agency response to other agencies. Among the 4 system models introduced at the study session,
I think the translator may be on the wrong channel.
among the 4 EMS system models introduced at the study session, the department has identified the Alliance model as the most effective and sustainable option and has initiated actions to evaluate its viability for this county. On September 8th of 2023, the department released an informational memorandum to City Council informing that the department would be releasing its own request for proposal soliciting proposals from qualified ambulance service providers to provide emergency and non-emergency ambulance services to the city as the exclusive subcontractor throughout the exclusive operating area in the County of Santa Clara. At present, the department is engaged with a provider seeking to agree on terms consistent with the alliance model as discussed during the October 16th study session, prior to the release of a County 911 ambulance services RFP. The purpose of this action was to determine the viability of an EMS service model where the City of San Jose would be the county-wide ambulance provider, subcontracting ambulance services to a private provider. This model has become known again as the Alliance model in California and is currently in place in Contra Costa County, the City of San Diego, and Sonoma County. It has been awarded in Santa Barbara County and San Bernardino County and is being evaluated by several agencies in other counties. The Alliance model offers greater integration between first responder agencies and the private ambulance provider, leveraging the high level of cooperation and coordination that exists between regional fire agencies. Additionally, this model can result in greater system sustainability that is improved because public providers can achieve greater cost recovery, availing funding for reinvestment into the local EMS system. Contra Costa County was awarded ambulance services, Contra Costa County awarded ambulance services to the Contra Costa County Fire Protection District in November of 2015. The Contra Costa County Fire Protection District bid the county's request for proposal jointly with American Medical Response as a subcontracted provider and began providing ambulance transport services on January 1st of 2016. In its 8th year, the first Alliance model has proven beneficial in several ways. It enhances ambulance deployment beyond levels to ensure compliance with response times as required by the existing county policy. It leverages all funding sources that are not accessible to a private provider independently, securing long-term financial stability for the provision of all contracted services. It expands the number of positions dedicated to overseeing and managing the subcontractor and the county EMS agreements. It establishes a long-term reserve account funded annually to address any service contingencies or emergency needs. It generates revenues to support future system enhancements, including the implementation of a nurse navigation line, mental health crisis units, or alternative destination transportation options. On the slide currently shown, on the left, we provide a fictitious billing statement for services rendered for a typical ALS response, including patient treatment and ambulance transport. In the right-hand table, we provide pay centers, or EMS service revenue sources, with respective estimated proportion of system users. This is often referred to as the payer mix. The major pay centers are Medicare, Medi-Cal, commercial insurance, and private payer. The second row of that table on the right shows what typical payment cap is for each of the pay centers. Note that the private payers include a wide economic diversity as a combined group, including those who can afford to pay the total ambulance transportation cost and those who cannot perhaps afford to pay any portion of the fee. However, with the implementation of the Affordable Care Act for California and California Covered, this demographic is continuing to transition to the insured category. The impact on the overall collection rate remains difficult to estimate, as many of the plans through Covered California have higher deductibles. Note that Medi-Cal patients being transported by the public provider under the Alliance model have enhanced reimbursements offered through a program called Public Provider Ground Emergency Medical Transport, or PPGEMT. This program is a program that private providers do not have access to. A typical PPGEMT enhancement offers up to $400 of additional reimbursement on Medi-Cal patient transport when compared to a private provider. In summary, the current agreement with Rural Metro Ambulance and the County of Santa Clara to provide 911 ambulance services will expire on June 30 of 2024 with an option to extend for an additional term. The department will also see an expiration to the first responder agreement between the city and the County of Santa Clara in the subsequent year. The expiration of both of these agreements will ultimately serve as an opportunity to reform our EMS system, which the department sees great need for, either through an alliance or fire-based ambulance transport model. This will serve as the transition needed to optimize fire and EMS delivery through system integration, retention of revenues to recover costs for services provided, and an opportunity to reinvest in system enhancements that ultimately innovate and refine services that better meet our community's needs.
Okay, in the following slides, we're going to kind of pivot to the department's annual EMS report for fiscal year 2022 and 2023. So this slide depicts the department's total call volume and its relation towards EMS responses versus the county ambulance responses. The red line is the county ambulance, orange line is San Jose Fire EMS responses, and the blue columns are total department emergency responses. As you can see, leading up to fiscal year 2020-2021, the department saw minimal changes in EMS responses, typically hovering around 1 to 2 point variance year over year. In fiscal year 2021-2022, EMS responses jumped 12% from the previous year, and then again in fiscal year 2022-2023, increased another 7%. We see similar trends in total department call volume as EMS responses steadily account for 62% of calls for service. An interesting point to note is that county ambulance responses decreased last fiscal year. Okay, according to the California State Plan on Aging, the number of county residents here in Santa Clara County aged 85 and older are estimated to increase 85% in 2030, and county residents above age 65 will increase 99% by 2030. Those 85 and older have a significantly higher rate of severe chronic health conditions and functional limitations that result in the need for more health and supportive services. The rapid growth of this age group has many implications for the healthcare sector. This chart reflects the department's EMS dispatches based upon reported ages of the patient from caller information. As you can see, over half of the department's EMS dispatches are attributed to patients over the age of 60. The EMS division reviews patient care reports that are completed after each patient contact. This data is used to track trends that could better define the sudden increase in EMS call volume. The department responds, as you can see in the top row, to more traumatic injuries predominantly associated with falls, which corresponds with the previous slide about our aging population here in Santa Clara County. The department has provided mandatory training for all uniformed, sworn response personnel to improve service delivery in EMS and to meet required state and federal guidelines. In fiscal year 2022-2023, the department delivered training on the new concept of law enforcement disengagement, a de-escalation tactic employed by law enforcement partners in the field when faced with a subject who may be experiencing a mental health crisis. This training ultimately allows our field crews to simultaneously disengage and clear the scene with law enforcement personnel once the determination is made that tactical disengagement is the final course of action. This allows fire companies to return to service and be available for the next emergency. The department also deployed Operative IQ in fiscal year 22-23, a cloud-based technology capable of tracking controlled substances in accordance with Drug Enforcement Agency requirements. This robust platform also allows the department to perform real-time audits of narcotics carried on each apparatus, down to the vial, lot, and control number with expiration dates. This improves efficiency and cost recovery when it comes to inventory control, purchasing, and deployment. Also in fiscal year 22-23, the department worked to address critical equipment procurements and replacement needs to continue to meet EMS care protocols and standardization across all response units. This includes automatic external defibrillators, advanced cardiac monitors and defibrillators capable of streaming patient data to downstream care providers, and mechanical chest compression devices that provide hands-free, high-quality compressions, which also allows responders to initiate other life-saving techniques. The department also experienced the impacts of the nationwide paramedic shortage, finding few licensed paramedics in applicant pools amidst increasing vacancies created by attrition. The result was an increased and excessive demand for overtime on firefighter paramedics. In response, the department approached former paramedics within the fire engineer and fire captain ranks to reactivate their paramedic licensure and accreditation to ease the pressure on firefighter paramedics. This strategy has proven successful. In December of 2022, as you see in the chart, firefighter paramedic mandatory callback peaked to approximately 9,000 hours and was reduced down to less than 2,000 hours in July of 2023.
Thank you for allowing us to present today. We stand by for any questions, and particularly, just a reminder, we have our friends from AP Triton who can answer questions about ambulance service models.
Thank you, appreciate it. We're going to go to public comment first.
We have no public comment.
So there being no public comment, we'll come back to the committee. I would just say that whoever makes the motion to accept the report, we need to cross-reference it to the full council for approval at its April 23rd meeting. So just whoever wants to make the motion, make sure you include that. Let's give me a second. Let me see who's, okay, first we got Councilmember Duan.
Thank you, staff, for this report. I just want to thank you, the San Jose Fire Department, for doing incredible work with the amount of firefighters and with the rising of calls. I believe probably in 2024, it will be about 115,000 calls this year, anticipating. And that's enormous amount of calls for 33 stations that we have. But I do have a few questions. Now, regarding the amount of calls that we missed, is there a documentation of how many ALS calls we missed, how many BLS calls, and how critical those ALS calls regarding like heart attack, stroke, maybe even fire, when we have our rescue unit going out on a response, and sometime our engine go out with our paramedic to support the lack of support from our county EMS ambulance.
Thank you, Council Member. If by missed your question means delayed response, we don't have analysis to the call level at this point, but I can tell you that statistically speaking, it would likely mirror the normal distribution of calls, because the vacant response areas where our resources are missing would not really discriminate for the next call type. So I think it would average to the normal distribution of call types.
So how many more minutes and delay of response when your second due have to respond into the first due?
Thank you. So we try to achieve a 4-minute response times as we contemplate positioning stations. However, as you are aware, council member, our distribution of stations is quite sparse in the city, and so the response to your question would be varied based on location. In a downtown setting, we still might meet that time or come close to that 4-minute response time from a second due station because stations are closer together. However, it would be highly unlikely that we would make our times in the perimeter of the city.
So because of geographical areas, our station are set to 6 minutes response time, right? Approximately, with traffic and everything else, even though our goal is to respond within 4 minutes.
I don't think I would characterize it as 6 minutes with traffic. I think I could do a better job of indicating where we are not within 4 minutes. We have partially addressed that with the positioning of new stations that are being built through Measure T funding. I would say that the range could be 4 to 6 minutes depending on the station.
So let's say 4 to 6 minutes, that's within their first due. Now when it's second due, have to respond. So therefore, it's additional 2-3 minutes, maybe even more, in order to service our residents. Is that correct?
I think generally that would be a fair characterization.
And so if you're having a heart attack or a stroke, usually we're trying to make it there within 4 minutes or 5 minutes. Would you say that is extremely critical? Those extra minutes could hurt or decrease the survivability of a person who having at least a heart attack.
Yeah, I would say that it's more than generally accepted that there are particular responses that include perhaps cardiac emergencies, CVA or stroke type calls, trauma. There are calls that really require fast intervention, not only for pre-hospital care, but also delivery to emergency rooms.
Thank you. And with our delayed response, does the county EMS fine us when we're late?
The agreement between the city of San Jose and the county of Santa Clara relative to our services first responders is a performance-based agreement, and to your point, yes, the funding that we receive in that agreement is contingent upon our response time performance, yes.
So by having the alliance model, that would help us recoup a lot of those fines from the county EMS, and that would benefit funding toward the fire department. Is that correct?
I think I'll let Ed or Tim talk a little bit about that particular question.
Thank you, Chief. For the record, Evan Rodriguez, Senior Project Manager with AB Triton. Thank you, Council Member. In the studies that we're currently finalizing for the city through the fire department, you have a much higher level of enhanced revenue through the alliance model that a for-profit private ambulance company under contract with the county would not have. So you would have the additional funds available to increase resources, to meet response times, to have surge protection, to do all the things that currently can't be done because funding is limited to the extent it is. That's one of the, and if the chief talked about earlier, that's why so many counties are going to the alliance type models, because of that enhanced funding, and you're maximizing the resources of local public safety agencies with the expertise of a private company, and you're really meshing the best of the public and private together for improved patient outcomes to make sure that we can get to that stroke or STEMI patient in that 4-minute period as fast as we can, as quick as we can, and there aren't delays. Without that extra source of funding, without going to that next step, we're just going to have the same system concerns that we do today, if that answers your question.
Thank you. Last question. With the amount of station that we have, with the geographical travel distance is quite extensive. I know that we have Station 32, 36 on the way and replacing Station 8. With few extra station, would that help overall in reducing amount of the response time to the city as a whole?
Thank you, Council Member. The deployment of resources on the fire or first responder side, the answer directly is yes. More resources deployed in tighter configuration across the city would absolutely do two things. One, it would create shorter response times, and two, it would address partially high volume as well. However, that alone would not solve ambulance availability, so that would be a separate challenge.
Thank you, and I move to accept the report with cross-reference reference to full council on April 23rd.
Okay, a motion and a second. Now we'll go to Councilmember Batra.
Thank you for that report, and I like the emphasis on trying to look for a model which is going to allow us to meet the needs of our residents. And as you have well documented, that for the last few years, our response times and our ability to meet the requirements has been not as good. My question is, I know from your presentation at the study session and other, that the alliance model is likely to give us what we need. I need to hear a little bit about that. This is a private contractor just hired by a different agency. Changing the agency, how will that improve the performance of the private contractor?
Thank you, Council Member. I'm going to defer to Ed, who really has been engaged for that very purpose, to understand that very question.
Thank you, Chief. Councilman Batra, great question. The best way I can quantify it is the current system, which is contracted to the County of Santa Clara, is a private provider, countywide, outside of the city of Palo Alto, here in Santa Clara County. With that, any additional revenues that they make go into their profit margins. There's very little reinvestment back into the city. They're contracted to maintain a level of service that, quite frankly, they have not maintained under contract for several years now. That's why the fire department's taken the great steps they have in the rescue medic program, the paramedics across the city program, et cetera. The alliance model now makes the private provider responsible to the city, because the city is the bidder of record. You have greater local control that you don't have today to hold that provider, but you also have the resources of the fire department to provide cross-staffed surge protection. God forbid there was a major incident in town, you can quickly ramp up additional resources. You don't have that capacity today because you're under constraint by the county contract. Under this model, although we would respond to a county contract, we're telling the county how we're going to do things, and we're going to do it much better and quicker. And with the additional revenues through the PPGMT program, you can make all those concepts I just talked about a reality. And that's how the system will get better. And that's why that private-public model under the City of San Jose Fire Department would enhance overall services in the future once we're awarded that contract.
Thank you. And you have a comment to make?
Thank you. As we spoke in the October meeting last year, one of the advantages to this type of system, if you will, is a goal of reducing your call volume, right? So we have those underserved, those critical type patients in an alliance model where, in this case, City of San Jose, they can go beyond just responding to the 911. They can set up a mental health type of response team. They can do the nurse navigation, community paramedicine, all these other areas by statutory regulations aren't allowed by a commercial ambulance provider. So it gives you, through the fire chief's accountability back to you, that ability to redesign the system to what you need. An example, Ed and I worked on the county of San Bernardino, and excuse me, one of their critical models is, they call it a COAST team, but it's a mental health response. And it's a multidiscipline team that takes the priority away from the fire department, takes it to the mental health, social services, those types of things. State statute doesn't allow it to happen unless it's through a governmental agency, fire service, if you will. So those are the things that today you're just wanting an ambulance. What the chief is looking at is, what is the system? What is the redesign? And as you said, to your residents, to your, we call them patients, but to the residents of not only the city of San Jose, but the county, that's what this model brings to you. So everything you can envision, there's a cost there, but now there's a different set of revenue that you just don't have today. Or if they extend the contract for the next several years, it doesn't come into play. Thank you.
Thank you very much. Yeah. Okay. So, Chief, are there budget implications to this new model selection? Is it cost going downward, or is it going upward, or staying the same, or no implications?
Please, Councilman, re-ask if I missed the point of the question, but I will say that currently the budget implications is that our residents are not receiving the services at the level that we are deployed to deliver them. And that is because with low ambulance availability, we remain stranded on scene longer, continuing care for the patient that under normal circumstances, or at least under the correct performance, would be en route to the hospital much faster, and our fire resources would be available sooner to respond to the next emergency. The other challenge that we would no longer have, that is also part of that diminished service level, is that with the BLS, or basic life support deployment of ambulances, we are frequently asking our firefighter paramedics to do their primary job, which is to respond with the fire engine, arrive first on scene, assess patients, initiate care, and then when a basic life support ambulance on scene and advanced life support care is needed, they have to then become the ambulance provider's paramedic, and they jump in the ambulance with the patient, continue care, and deliver them to the emergency room. It's terrific care for the patient, but it does diminish our resources while they're in the act of doing that service.
Right. Thank you. And obviously, assuming that you're going to go with this route, you're evaluating it, the transition, would there be enough protection that we do not get any degradation of service during the transition when you're going from one model to the other?
Thank you, Councilman. I am going to let Ed answer that because he has experience in that very thing.
Thank you, Chief. Councilmember, yes, generally when a new award to a new system or a provider, in this case the City of San Jose with their subcontract partner, there would be a time to ramp up the new service. Generally that can be anywhere from 6 months to 18 months, and that's negotiated with the county for how much time you need. If you went with the existing provider, obviously they have infrastructure here, trained personnel, et cetera. And generally with the new contract, or maybe spoke of the mental health processes, serving the underserved populations, et cetera, those are the things that really would take our time to expand, but we would be given enough ample opportunity to do that. So on the new start date, whatever that start date is in the future, you would just see a seamless transition of anyone calling 911, a fire engine and ambulance are going to be there as requested in that proper amount of time.
thank you for the service, and keep us safe, keep the residents happier and healthier.
Thank you.
Thank you. Next, we have Vice Mayor Kamei.
Thank you so much for the report. I want to thank you for, just doing this whole sort of analysis, because I think that this has been sort of a problem that has been happening, and, it's gotten to the point where it's not sustainable. And it really is causing a lot of impacts to the fire department. So thank you for your evaluation. Thank you for bringing forth these different models. I'm very delighted. And I think that, in terms of the way to go, this is something that I think is the way to go. And as we sort of keep moving forward in this sort of a alliance model, one of the things that I think is going to be important is looking at the data. And as you've already demonstrated to us, our population is aging. So as we look at the demographics of, who are the ones who are needing this service, I also wanted to sort of think about, in the future, we're probably going to need to know more frequency of those who need that service, and whether or not there are other options to offer. And I think that that's something that, as we get to know more and see more information, it will inform our decision making. So I'm just tremendously delighted that this is moving forward. I think that it's a smart thing to do, and I like the idea that it has that revenue component that can make it sustainable, and reinvestment into the system makes a lot of sense to us. And I think that, our community will benefit tremendously. I did have a clarifying question in terms of the revenue sources. Would that be managed by the city, or who when we look at, the costs of all of this? Obviously, there'll be some revenue generation. Would that be the city doing that?
Thank you for the comments and the question, Vice Mayor. Right now, what we're contemplating is a department-managed billing process. However, we are evaluating a model that would outsource to a professional service that does this type of work already. Okay. And so we would be the billing agency in effect, but would contract out the technical aspects of that service. And then I will ask Ed if you have more background on that.
Thank you, Chief. Correct, Vice Mayor. Under the new contract provisions, once awarded by Santa Clara County, the City of San Jose would be the bidder of award. So the service would be a contract between the city and the county for the entire county exclusive operating area. As the chief mentioned, we would subcontract out the billing portion of the services, and all the revenues from the provision of the services will go back into a city account for disbursement to pay for the services. So all the revenue accountability, the billing accountability, the collections, et cetera, would be under the purview of the City of San Jose.
Yeah, because I know that we already do billing in other departments, other areas. However, when you sort of open up the Medicare, Medi-Cal, that's a different world. And I'm assuming it'll be overseen by finance, but I just was wondering about, we're getting into something different. And yes.
Correct. Medical billing is its whole entity, as you just alluded to, and certainly there are companies out there that a number of fire departments across the state and fire districts utilize, and that do provide professional services with 100% accountability, but ultimately it'll be the chief staff and the finance staff of the city that coordinate that and do the close monitoring.
Okay. I think that's important to know, because I think that we're sort of modeling what has already been done before, and we're not sort of opening up another department. So I think that that's pretty important. Well, thank you so much. I appreciate this moving forward, and am delighted to support it.
Okay, great. There's a motion and a second. We'll go ahead and take a vote. Someone hasn't. Did everyone vote? Okay.
That motion passes
Okay.
unanimously.
Great, thank you. Appreciate your time.
Thank you.
We'll move on to item number 2. It's language accessibility.
Chair,
Yes.
can I cut in for a
Yes,
second?
please.
I'm sorry. Can we go back to item B1 and do a motion on that to defer that item, since it did not go to rules first before coming here for deferral?
Yes, thank you for catching that. So we'll go back to item B1 before moving on. Everyone can make their way down. That's gender-based violence annual report, essentially deferring the item. Go ahead and vote. All right, it's unanimous. All right, we'll go back to,
What was the motion for B?
the motion was to, well,
I didn't hear.
we need a motion, I should say. I just made the motion on my own. Well, we need a motion to defer the gender-based violence annual report from this meeting, to defer that to the May 16th public safety meeting.
So move to defer to May 16th.
Is there a second? Second. Okay, motion and a second. Okay, now we'll vote again.
Can I take a verbal vote for that?
Yeah. All those in favor? Aye.
Thank you so much.
Okay, thank you. All right, wonderful. We're going to move now to item 2. As I said, that language accessibility report. A host of folks joining us. I'm not going to go through the whole list, but go ahead and take it away. You want to start?
Good afternoon, Joe Roy, City Auditor. I'm here with Brittany Harvey, Adrian Perez, and Hawad Hyder from my office to present our audit language accessibility. The city can strengthen efforts to address language equity across its services. Also in the box are Carolina Camarena and Marisa Diaz from the City Manager's Office of Communications. The City of San Jose serves a diverse population with more than 57% of its residents reporting speaking a language other than English at home. Under the city's language equity policy and guidelines, departments are expected to take reasonable steps to provide equitable access to language assistance services. This includes such things as informing limited or non-English speakers of eligibility for programs and services, ensuring staff has proper training in the
Actually,
use of...
Joe, if you can, sorry to interrupt, if you can pause, our screens are stuck just on the voting. For those of you who don't know, we often follow on the screen what you're talking about, Joe. So I think it's fixed now. All right, wonderful.
All good?
Keep going. Thank you.
Okay, so other parts of the language equity policy and guidelines, quickly run through a few of the expectations of departments under the city policy manual. Informing limited or non-English speakers of eligibility for programs and services, ensuring staff has proper training in the use of over-the-phone interpretation services, making phone tree instructions available in Spanish, Vietnamese, and Chinese, prioritizing vital documents for translations in those languages, and incorporating various best practices to assist limited or non-English speaking residents. Administration has developed resources to assist departments, including providing language and cultural responsiveness trainings, developing agreements with language translation and interpretation vendors, and providing premium pay for certified bilingual staff who assist non-English residents in accessing city services. I do want to point out that the city has been making efforts to improve how it interacts with residents, customers, and businesses. Two related bodies of work include the development of a customer service vision and standards, and the work of the Office of Racial Equity. Objective of this project was to assess city communications for compliance with the city's language equity policy and guidelines. For this audit, we focused on common customer contacts for direct services provided by city departments. We did not include interpretation services for city council or other public meetings or other broad community engagement activities. We had two findings. The first finding is that departments have made some progress on addressing language accessibility, but additional work remains. Based on our review of 5 city services, we found that all had made some progress in implementing aspects of the city's language equity policy and guidelines. Some highlights include the library and energy departments consistently translating vital documents into multiple languages. The library's checkout machines also provide services in multiple languages. There is multilingual signage at multiple departments, including the library and animal care center. The fire department has procedures to identify fire stations with high multilingual needs and encourages bilingual firefighters to bid for assignment at those stations. And multiple departments had access to or tracked customer calls or services provided in different languages. However, we did note that the reviewed services varied in the extent to which they addressed the policy's requirements and best practices. And we found that addressing language at common points of contact with customers, such as phone trees, the city's website, and at city facilities, can improve services. We also found that departments have not generally assigned language access coordinators, which is a best practice recommended in the policy. It should be noted that some individuals in departments fulfill aspects of those roles. The administration can provide additional guidance or resources for departments, such as templates for formal language access plans, assistance in identifying vital documents for translations, and others. And lastly, there are currently no performance metrics or systems to gauge progress on language accessibility and promote improvement over time. So we recommend the administration monitor language accessibility of common points of customer contact across departments, require customer-facing departments designate language access coordinators and develop language access plans, develop additional resources to support department efforts around language accessibility, and create performance metrics and a system to review progress. The second finding is that bilingual staff are a resource to the city, though clarity on their role is needed. As of June 2023, the city had close to 900 certified bilingual staff who provide language assistance to residents. Bilingual staff play a critical role in helping residents access city services and resources in language that they understand. They use their bilingual skills to provide direct services to residents, businesses, and visitors, and to translate written or electronic material. Certified bilingual staff generally share that they have a positive view of their work and assist their own departments as well as other city departments. Certified bilingual staff also noted that their regular duties can be impacted by their bilingual workload. For example, more than half of bilingual staff responding to an auditor survey noted that their bilingual responsibilities impacted their workload, and 27% that it had a high impact on their workload. Additionally, some staff have been asked to act as interpreters, which they may not be qualified or trained to do. And although the city has made improvements to the bilingual certification process, there may be potentially certification records not on file for some certified bilingual staff. So we recommend the administration clarify the expectations and role of bilingual staff, including those that do not receive bilingual pay, as well as reconciling bilingual certification records for staff who receive bilingual pay as necessary. The report has 12 recommendations. I'd like to thank the City Manager's Office of Communications, the City Attorney's Office, certified bilingual staff who participated in a survey and focus groups that we conducted during the audit, and all the city departments who assisted in the audit for their time, information, insight, and cooperation. The administration has reviewed the information in the report, and the responses shown in the yellow pages. I ask that you accept the report and cross-reference to the April 9th meeting of the City Council. Now turn it over to the administration for their response, and of course, we're happy to answer any questions. Thank you.
Thank you, Joe, and good afternoon. The administration would really like to thank Joe and his team in the City Auditor's Office for their comprehensive analysis of the compliance with the city's language equity policy and guidelines. Now, administration agrees with the 2 findings and 12 recommendations identified in the report. We are eager to begin coordinating the implementation of the recommendations with departments and align the recommendations with other city initiatives such as the customer service and vision standards and efforts led by our Office of Racial Equity. I would like to note this is the first year of a language access manager, Marisa Diaz, and the recommendations included in this audit lay the foundation for our work plan for over the next several years. The Office of Communications looks forward to improving ways to provide excellent service to all through language access, and we are also ready for any questions.
Okay, thank you. We're going to go to the public first, or any public comment?
We have no public comment.
Okay, all right, thank you. We'll go to Vice Mayor Kamei.
Thank you, and thank you for the report. I will say I've only been here a year and a little bit, and I think that the city has made a lot of strides in, allowing for access of translations, of, making available access to those who are monolingual. I will say that as a native Spanish speaker, we need to do better. We really, really need to do better. The quality of some of the translations are not accurate. And it's painful for me to sit here and listen. So what I would say is that as you evaluate this next coming year, it would be important to ensure that we have high levels of standards for whoever we have doing any kinds of translations. I can't speak for Vietnamese or Chinese or other languages, but as a native speaker, I have observed some inaccuracies or just not at the level that I would expect for us to be. So I guess what I'm asking is for there to be a higher standard of translation and interpretation that needs to be established. And I know we're just starting, this year. It's been great and all of that, but I think that we need to up our game and really just be a little bit more mindful that accuracy is important. So when someone is saying something and we're listening, that it is, in fact, what it's supposed to say. So with that, I just appreciate it. I accept the report and would move the report.
Right, and I should have, sorry, I should have said this at the beginning, but we're going to be cross-referencing this to the April 9th, 2024 council meeting, so if the motion can contain that.
And cross-reference it to City Council on April 9th.
Second.
Wonderful, so motion and a second. Next, we have Councilmember Duan.
Thank you, Vice. Thank you, staff, for the great report. And I agree with Vice Mayor Kamei. As a native Vietnamese speaker, I hear translation, and sometimes people just ad-lib, or at least add their own interpretation into not actually interpreting what the speaker is saying. And it is true that we can improve on the quality of our interpreter, and that's throughout the city as a whole. And I know there's a huge need, especially in the Vietnamese community, for translation, and also in many of different of our departments. Some department will have translation quite a bit in Spanish, but nothing in Vietnamese. And the Vietnamese community now is above the 13% threshold. That's more than 130,000 residents. And I would appreciate that you give that some consideration. Well, I do see that there's a lot of work to be done. And out of the recommendation, I believe there's 5 major city service in the department. How is staff going to prioritize the work, and what will be the first action steps that will be taken?
Thank you for that question. I think it's a great question, and it's one that I think we will go back and take a look at, really trying to prioritize by departments who are more public-facing, as they are the ones who will be speaking with our monolingual residents. And from there, we're going to adopt some of the guidelines and recommendations and move forward. So we'll prioritize departments that are public-facing.
Thank you, and I know that I think we have less than, well, what, 200 employees in the city of San Jose that are Vietnamese speaking. That doesn't represent the population, and therefore more likely we're not going to be able to supply the interpretation as needed. And I hope that we'll work on increase that number of employee as well. Thank you.
Okay, it seems like those are all the comments. We'll go ahead and vote. Okay, I think it's unanimous. Thank you. Well, thank you for the report. And we'll move on to item 3, which is recruitment, hiring, and retention strategies by annual status report. We have Lynn Lee, Randy Perry. Give us a presentation. Thank you.
Good afternoon, Jennifer Shembri, Director of Employee Relations and Human Resources. I'm just going to kick it off and then turn it over to my amazing staff to do the presentation. And I wanted to start with introducing our new Deputy Director in Human Resources over our Employment and Learning Development Division, Rashid Hurd, who's sitting right here to my right. And you will see him in the future doing these presentations. But for now, we're going to turn it over to Randy and Lynn. Thank you.
Thank you, Jennifer. I'll go ahead and get started with the recruitment and hiring strategies update. This first chart here shows the city's overall vacancy rate is stable despite position adds year after year. The vacancy rate as of February 2024 is 12.2%. This is a summary by month. This is a summary by month of the total number of vacant budgeted positions and the accompanying vacancy rate. As you can see, both of which are on the decline. And this chart just simply shows the vacancies by departments. I believe this was an ask from one of the council members to see individual department vacancy rates. Our classification unit consists of a program manager, senior analyst, and an analyst, and they're working very hard to maintain our classification system of about 700 job codes. Up-to-date classifications are critical to the recruitment and retention of employees. On the recruitment side, broadening the MQs to increase the applicant pool and to reach applicants who may not have had opportunities to pursue a higher degree is an important strategy to recruit new employees to the city. And on the retention side, expanding the class series to create a career ladder for promotional opportunities contributes to a clear professional goal. For example, creating a series of classifications, 1, 2, 3 levels, so that when they enter at the 1, they know that there are 2 more levels that it can promote to if they stay in the class. The centralization pilot provided additional recruitment resources to PRNS, housing, PBCE, and this greatly contributed to the reduction in these departments' vacancy rates. If the centralization pilot is continued in the budget, we would address the other goal of centralization, which has not been addressed yet, and that is to pilot innovations and initiatives in the recruitment process and relationships with the HR and hiring departments. Recently, we launched NeoGov, which is our new online application system. And since its launch, we've seen an increase in the number of applications received. We are currently in the optimization phase, which includes several projects such as improving training resources for department users and utilizing analytics and reporting. And I'll hand it over to Randy.
Good afternoon, committee members. I'm Randy Perry, the program manager over our workforce learning and development team. All right, my first slide. All right, we recently kicked off phase 2 of our hiring campaign in partnership with the City Manager's Office of Communications. So we've updated the graphics for the hiring campaign, so you can see a couple of examples on the screen of our new graphics. We're going to update the sign outside of City Hall, and this hiring campaign is continuing to focus on our hard-to-fill positions. We're using employee stories and day-in-the-life social media posts to advertise what it really is like for employees to work here at the City of San Jose. We're going to do paid and earned posts on LinkedIn, Facebook, Instagram, and X, formerly known as Twitter, and we're also working on to increase our social media presence, to increase our traffic and our impressions to our different social media pages, and this includes posts about different professional development opportunities here at the city, and different workplace culture items to attract more traffic to our social media. This hiring campaign will also, again, put some signs on the backs of VTA buses, and tailgate and side profile ads with routes in San Jose and other nearby cities. There is one billboard up off of 101 right now for this hiring campaign, and they are currently exploring some Clear Channel digital billboard advertisement with the hiring campaign, some radio advertisements, including one bilingual ad on a local Spanish radio station, and some ads on a streaming station, Pandora. And Our pipeline team has been incredibly busy creating some engaging and exciting events for our local high school and college students. The photo on your screen depicts a recent building trades industry panel at Silicon Valley Career and Technical Education, SVCTE, where we had 6 different employees from 3 different departments talk about their career at the city. All of them work in the trades here at the city of San Jose, and that hit 180 students over at SVCTE. Panels like these show students that public service careers can provide stable employment, a living wage, and a work-life balance that could enable these students to stay in the city that they grew up in. And these types of panels are really critical to attracting the next generation of our students to public service work. We wrote about many of the events that we've done over the last 6 months in the memo, but I just want to highlight a couple of them here. The next one is that we recently did a Public Works City Hall tour with some high school students from Yerba Buena High School. And we invited their Building Careers Pathways class to take a tour of the inside and behind the scenes here at City Hall. Our Public Works team showed them the huge generators downstairs that I'm sure most of us have never seen, and how we test the City Hall fire pumps monthly, and they even took us to the roof above the 18th floor. I wanted to do a shout out to Councilmember Torres, who is not here today, but we took an unplanned detour through the 18th floor, and he and his staff came out and said hi to all of our students, and then talked about working for the city and public service. So that was a really cool chance for our students to connect with a council member up on the 18th floor. And then there's a picture up here of Mr. Ochoa, who was the teacher of this Building Pathways class, and he was really overwhelmed at the experience, and something he said is, these are life-changing experiences for the students who came today. So I'm gonna guess that you might find some pretty cool pictures on social media of these 30 high school students standing on top of City Hall, and my hope is that, you know, in 10 years, when they're walking through City Hall as employees, they're gonna pull out that picture and say, one day I stood on top of this building, and now I work here. I just wanted to also shout out, our team is hard at work planning our next Explore Careers event that is next week, just 6 days away, where every single city department will be showing what it's like to work here at the city for our San Jose State students. It is next Wednesday, March 27th from 11 to 2, and we'd love to see as many people there as possible. We expect 300 to 400 San Jose State students to come through the rotunda and outside. We'll have one of our fire engines there, some of our public service vehicles, and lots of people to talk about their career at the city that day. So join us if you're able. And then, just a quick note, we're offering tons of professional development opportunities through our team this year. 2 areas we're making some we've made some serious investments this year is on our analysts. The city employs hundreds of analysts throughout the city that do tons of different types of work. So investing a lot of training and resources toward that group of city employees. And then to our mid-level managers. So creating some training and development opportunities for those people in that band, our city employment as well. And that concludes our update for you all. We will be back here in December with our next report, but until then, we'll continue to evaluate new ways to continue to improve our recruitment, hiring, and retention efforts.
Thank you, appreciate it. Do we have any public comment?
We have no public comment.
Okay. I'll just say a few things before. One of them is the Public Works tour. I'd like to take the Public Works tour. I don't think I've seen some of that, which is pretty cool. And the other thing is, I was curious when you showed that photo of, I think Jesse was in the photo, but some of the folks at the CCOC, I'll just call it that, the Career Training School, on the panel, one of the things that came to mind is it'd be good to have a public official up there, but then you said work-life balance, well-paid, and this is not what we want to put out there, and so that came to mind as well. So with that, I'll go to Councilmember Dwan, please.
I'll second that. No, thank you. You've done an incredible job, especially if we compare it to other city around us. I believe we are the lowest vacancy rate compared to other large city. Am I correct on that?
We actually haven't looked at it recently, so I don't know that I could say that, but when we were looking at it about a year or so ago, we were one of the lowest.
Yes, and as our city continue to grow, we'll have more job opening and more needs. And so therefore, sometime you will see the vacancy rate because we create more position, or because of the needs out there for the residents. And therefore, sometimes people doesn't understand the vacancy rates. But I am extremely proud to say we, as a city, I would bet on the fact that we're probably the lowest with all the other metropolitan around us. And I know that we'll continue to lower that rate. And we continue to make sure that we recruit and retention of good employees. And we want to make sure that people know that the city of San Jose, it's a great place to work. I've been with the city now for 24 years, and retired as a fire captain. I couldn't ask for a better city and a better job. Thank you.
Well said. We're going to go on to Vice Mayor Kamei.
Thank you. I think that the progress is just incredible. I know that we're always moving, but I think that it just really shows how much you've done, and I just want to thank you so much. It's not an easy job, but I think that what you're doing and how you're sort of going out and letting others know about what we're doing is great. And just also working with the departments to create pipeline programs, I thought that was really great. So I just want to say thank you.
Okay, we're going to go to Councilmember Badra. And by the way, we're not cross-referencing this, and there hasn't been a motion. So if you feel so inclined, you can make the motion.
Thank you, Jennifer, and your team. I think when we were about a year ago looking at our vacancy rates and constant comments about how our vacancy rates are so high, even though there are some skills which are very hard to fill. But I think the biggest thing I can say is that you have really modernized the recruitment process. All of our communications on there. At that time, we were still doing probably just signed paper kind of mail, increasing that this is the job openings available. You were not using much of the social media and all that. So having brought that into the picture, and I think I commented last time, that when we are trying to hire the 20 years old or 21 years old people who have grown with the social media, they couldn't relate to our old recruitment methods. And they couldn't believe that they would be coming and working for a place which hadn't changed its recruitment processes implicitly. It told them that, hey, this must be working with old technology and probably not a place where I want to be. By showing them your approach to recruitment, it probably tells them that this is the place where high technology exists and I'll be working with the latest stuff, and encourages people to apply. You brought the vacancy rate down, and I love the fact that you're inviting people, students to come out here. I want to know is that I've been going to the high schools, and one of the things I've been offering them is that I don't know how much civic engagement you have, but I would like them to visit the City Hall, see the rotunda and second floor, where we have the history of San Jose, who made San Jose. But I don't know if there is a mechanism which exists that when these people come, we have a host who will take them around and give a tour. Right now my office will do that, but if you will be available in terms of through your office, some kind of a mechanism, I would love to see these students walk through our halls and really get to know their city and the government. So if you would consider doing something, or you already have in place, would be a better answer.
So I don't think there's a mechanism in place for individual students to come and ask for a tour of City
Not
Hall, but
individual, groups.
groups, yes. So
Yes.
the schools should reach out to us, to HR, to Learning and Development, and we can coordinate that. But they also have contacts already in schools and are working on some other things related to that. So we'll definitely continue to do that. And I just want to say I appreciate all of the thanks for the work that we've done, but it has absolutely been the team led by Randy and Lynn, and then our partnership with the City Manager's Office of Communications has really been instrumental in all of the advertising and social media that we've done. So, and they have amazing teams. Some of them are in the audience too. So it is very much a group effort. So thank you.
Yeah. So give me the contact who we can invite. It will be groups of students with the teacher, with the faculty and all that, and like to get them more exposed to our City Hall and the city government, which is a good thing to get them going. Okay, so I want to make the motion and to accept the report and cross-reference to.
No need to
There is no
cross-reference.
cross-reference on that?
No.
Okay, so you trained us on cross-reference.
No, well, that's why I
cross-reference.
mentioned no need to, because I
Great.
knew this would
All
happen.
right, okay, no cross-reference. Okay, make the motion to accept the report, and thank you and for the good work done.
Is there a second? Second, okay, wonderful. And I would just say, Councilmember Batra, I haven't done it in a while, but your key opens up the chambers, and so maybe I'll get in trouble by saying this, but I brought students in here and actually let them sort of sit where staff is, where we sit, take photos and talk to them a little bit about. So you can do that. I mean, I've done that, but I know that takes time. But,
Yes.
oh, see, I didn't let
Yeah.
facilities know.
We've
But
been meaning to talk to you about that for a while.
yeah, I know. But I mean, yeah. Anyway, I'll just put it out there. I'll give you the hack offline if you want.
Yeah, I want to do this on a regular basis, bringing it up a lot of.
And then there is, if you sometimes see, there's a gentleman, I forget his name. I'm trying to remember his name. I think he's a retired gentleman that roams the halls of City Hall. Sometimes you see him on the 18th floor, but he's, the docent is the proper, the tour guide, but he's walking around showing students often.
Yeah, so he's always in a green shirt. I'm forgetting his name off the top of my head.
Correct.
But in addition to what Jennifer outlined, there is an actual docent program at City Hall. It used to be far more regular that you would see them. They were kind of timed around council meetings, so you would see him and a lot of them in here at the beginning of a council meeting. So I know Public Works is thinking of reintroducing that frequency a bit more.
Yeah.
Thank you, thank you. I want to fully leverage that capability.
Wonderful. Vice Mayor Kameh.
Okay, there we go. I just wanted to for those who don't know, the clerk's office actually sent us a notice in like October or something like that, that specifies if you want to have tours, these are some of the things, these are the 1, 2, 3, 4, 5 things you need to do, and you can have tours. So I think that was very valuable. So I don't know if the clerk can resend that to everybody, because I think that it's very valuable to know. And yes, you know, you're welcome to invite people to see the chambers.
Cool. Yeah, thank you for that. Appreciate it. Okay, so we have a motion and a second. We'll go ahead and vote. All right, it's unanimous, I assume. Thank you so much for the report. Appreciate it. We're going to move on to item number 4, which is Community Emergency Response Team Status Report. I'll say this just for the sake of keeping us on the same page, is there is no need, we don't need to cross-reference this one. And so we have a presentation, Alvin, from the City Manager's Office. Please.
All right, good afternoon, Chairperson, Vice Chair, committee members, and members of the public. My name is Alvin Galang, and I am an assistant to the City Manager in the City Manager's Office of Emergency Management. Thank you for allowing me this opportunity to speak to you all on the Community Emergency Response Team, or CERT, status report. The CERT program was created in the mid-1980s and stemmed from lessons learned from the Mexico City earthquake as well as the Kyoto earthquake in Japan. Los Angeles fire officials traveled to Japan and Mexico and learned that everyday people became first responders and helped to free trapped victims. But unfortunately, a number of those volunteers became victims themselves. So in 1986, LAFD piloted the first CERT training where they graduated a total of 30 community members. And in 1993, CERT became part of the Federal Emergency Management Agencies and is offered in every state in the country, now totaling more than 600,000 CERT members nationwide. Fast forward to today, here in the city of San Jose, there are over 1,100 CERT members throughout the city. We currently offer CERT trainings every month and rotate the trainings throughout each district so that there is at least one training in every district each year. The 20-hour basic CERT course is offered in two formats. The traditional in-person course, which is spread out over a series of 3 days, typically a Friday, Saturday, Saturday schedule, where the final Saturday is dedicated Skills Day, where participants put into practice what they have learned in the classroom. The second format came about in response to the COVID-19 pandemic. This hybrid version is a series of live Zoom sessions 2 evenings per week, typically on a Tuesday and Thursday evening over a span of 3.5 weeks, and culminates with a Skills Day as well. And as with several city programs and services, our priority population are those marginalized communities that, compared to the rest of the city, may face extra or additional challenges during a disaster or emergency. These challenges could include living near an area that is prone to flooding, living in an area where it may be difficult for ingress or egress, or, as mentioned, communities where English is not the first language for the majority of the residents. Our CERT program is moving forward in finding ways to address all these circumstances. So moving forward, the Office of Emergency Management is aware that we cannot implement and grow the CERT program alone. We depend on our dedicated volunteers and partners to support our efforts in doing our best to make sure that our communities are prepared. Some of our partners include the 501c3 San Jose Neighborhood CERT, San Jose State University, specifically student interns that we have partnered with, Project Hope, a program under the Department of Parks, Recreation, and Neighborhood Services, and faith and community-based organizations, such as the Church of God, Community Health Partnerships, and the San Jose Conservation Corps. As the number of community members interested in the CERT program continues to grow, we are going to offer a third format of the CERT training, which is a self-paced online instruction, followed by an in-person knowledge and skills assessment. We have found that many folks find it difficult to invest and set aside 20 hours of in-person or hybrid training, especially when it is a set schedule and may not support or align with their life-work balance. So the goal in offering this additional format is to hopefully add more flexibility and meet the community's needs, which may in turn increase our participation numbers. We will also incorporate an intentional focus on CERT data and analytics. As mentioned, we've partnered with San Jose State University's Management and Information Systems students, and they have created a CERT dashboard that will help us keep track of our volunteers, focus our outreach efforts, and forecast the growth of the program. And so here you'll see examples of CERT in action. The larger screenshot is taken from the CERT dashboard that our San Jose State students created. The pictures that are surrounding the dashboard are examples of how CERT is engaged in the community. Whether it's outreach events like info nights or community celebrations like the Oban Festival, or our CERT trainings in other languages, the word about preparedness is spreading like, I won't say it. However, community members are becoming increasingly interested in learning about how they can prepare themselves, their families, and their neighborhoods in the event of a disaster or emergency. After all, CERT is about neighbors helping neighbors. And lastly, I would be remiss if I did not mention the passing of one of San Jose's premier CERT members, a retired San Jose Police Department Lieutenant Rich Saito, was the epitome of what an involved and engaged community member could and should be. Rich personified CERT and was instrumental in creating and participating in many initiatives around San Jose, including Japantown Prepared and the San Jose Radio Amateur Civil Emergency Services, or RACES. Rich was loved by the entire community, and his service and commitment to the community will live on. And with that, thank you. I am available for any questions from the committee.
Yeah, thank you, Alvin. We'll go to public comment.
There is no public comment.
So no public comment. We'll bring it back to the committee. Councilmember Dwan.
Thank you, Vice. Thank you for the report. I'm very supportive of CERT coming from the fire department. And I actually, one of my staff actually volunteered to teach the classes, and I myself, when I have time, I go out there and teach the fire extinguisher class as well. I do have a question. Your goal is to educate 1% of our population. That's a big goal. 10,000, right? So I know that each class costs around $7,500. At $100,000, we'll squeeze in about 12 classes, and each class anywhere between 20 to 30 participants. So I rounded off to a higher number, if you will. So we would get 30 participants, about 360 per year. So it would take us 20-something years to reach that goal. How can we expedite or do better in order to create more classes, to get more certified individual from all ethnicity to be part of the resident here in the city of San Jose?
And that's a great question. Thank you, Council Member. I don't have the exact answer on how we can increase those numbers. I can compare it to Los Angeles County, where they have roughly over 57,000 members, CERT members. But when you take into account that they started nearly 40 years ago, it took them roughly 40 years to reach that number. And so, again, your calculations are fairly correct, right? In how are we going to reach that 10,000 number? I don't have an overall, like, this is how we're exactly going to do it. But as long as we keep pushing, as long as we keep our outreach and engagement with the community going, we will eventually get to that number.
And if I can jump in too, appreciate Alvin's response very much. And I would say, since Alvin has come over to the city manager's office of emergency management, I think we've been much more purposeful under his leadership around this program to grow those numbers. I think a few things. Obviously, it's always a matter of resources. The money that we've been able to invest in the Office of Emergency Management since the 2017 floods, as you're aware, Council Member, some of it's been in CERT. We've focused a lot on the after action report and really trying to fill out our annexes as well, which are very costly things. So when the disaster happens, we're literally taking plans off of a shelf as well, so that we can respond quickly. At the same point in time, obviously with CERT, the more we do that, the less there's a smaller portion of our community that we're responding to, because they're able to care for themselves and care for others. So I think, Alvin's been super smart about the third class, knowing our community, it costs so much to live here. We're all working so long. So that time investment is really hard here too. So with the online class, we're hoping that numbers creep up quite a bit. But this is definitely a good question to ask during the budget study sessions too, because the CERT program is a good use of one-time funding for certain things, and specific to your districts as well. So we can certainly provide those cost numbers during the budget process as well, if you want to be kind of specific around your council districts for this program.
Thank you, Lee, for that info, and we'll see what we can do with the budget. I think it's extremely important. It's not only a skill where you can use when there's mass destructions or major disaster. It's actually a skill that you can use with your family or friends when you go out to picnicking or you go out to camping or even bike ride down the street. You can use those skills to, stop the bleeding, giving first aid. Knowing all the parameter is extremely helpful, and I encourage the citizen to take advantage of the classes is offering, and especially online as well. I thank you for continuing the good work, and make sure you send my regard to Ray Reardon as well. And I move to accept this report. Thank you. So now it's Councilmember Arjun Batra.
Thank you for that update. We recently held a class in District 10, okay, Saturday. Two of my staff members already are certified, and District 10 has about 112 or so members already. But that still doesn't get anywhere close to the 1% because the population of District 10 is about 100,000. So we need 10,000. So we're not anywhere close to that number where we want to be, right? So I believe, like what Lee Wilcox just said, that I think that having the third format and giving it a publicity about it, I think should increase the number of people, because the biggest constraint on the people here is with their commute hours, working hours, and really most of the jobs in our city are not 8 to 5 or 9 to 5. They're 24/7 jobs, and finding a work-life balance. So I do believe that with the third format and us doing the publicity and taking more and more of what you're doing in terms of giving information about it, I think we can increase the numbers. Hopefully it won't take us 40 years like it took LA to get to the right number. And hope we never have to use these things in real situation. But we want to use it in situations like, when we are camping, we can take the benefit of these things. So thanks for keeping the momentum going, and we'll build more momentum, help build the more momentum. Thank you.
Thank you, and then we'll go to Vice Mayor Kameh.
Thank you. Excuse me. I really, really like your alternative to have it, sort of self-paced, because I think that will bring a lot of people into the fold. And I'm just wondering, I know many of us have newsletters and can push it out into the community. I'd love to be able to obviously encourage in person, but there are those who perhaps are not able to. And as you're, rolling this out, I'd really ask you to use us to, spread the word. And if you have, I do it once a month in terms of a newsletter. And if you have anything, sort of a little flyer, a little message, we can just push it out, because I think that it would help increase those numbers. So thank you so much for that.
Okay, and I think those are all the comments. Do we have a motion to accept the report?
We did.
If okay, I missed that, I apologize. Yes. Okay, we'll go ahead and vote. Thank you. Okay, it's unanimous. We'll move on to the last item, number 5. Thank you, Evan. Police Department Operations and Performance Quarterly Status Report. We have Assistant Police Chief Paul Joseph and staff to present. Okay, whenever you're ready. Good.
Good afternoon. This is our quarterly performance and status report. I'm joined here by Lieutenant Paul Hamblin of the Research and Development Unit. We're going to cover a number of different topics today. The first one will be an update on the NIBRS crime reporting system. We'll also talk about the redistricting project update, and then give you an update on illegal gambling enforcement. So usually the meatiest part of this presentation is our crime statistics. It's a best measure of how we're doing, so to speak. And back in October of 2022, we presented to the full council that we were going to be switching, along with all other law enforcement agencies in the country, from the previous Department of Justice standard of uniform crime reporting statistics to the new NIBRS system. And I realize that some of you actually weren't on the council at that point, so I'll just go quickly kind of over the broad strokes. NIBRS is a new way of reporting crimes with more specificity in order to get deeper into the statistics. Every law enforcement agency in the country will ultimately have to go to this new reporting system. Previously, we used UCR data, which only reported out on a handful of crimes. The NIBRS system captures a far greater number of crimes as a way of measuring overall crime rate. In implementing this system, we, like many other police departments and sheriff's departments in the country, ran into some issues having to do with training on a new system, some operational errors, some software compatibility issues. We had purchased a report writing system that was designed to capture UCR statistics, and when we switched over, there were some issues we had to work through with our vendor. To make a long story short, we haven't been able to report out on crime statistics since the switchover in April of 2023. However, I am glad to report that we have made large efforts to obviously get you these statistics because they're critical. They're critical for you as decision makers, critical for the public to be able to see how we're doing. And within a matter of less than a week, we should be able to give you statistics on our first 6 months of the NIBRS reporting. There are other methods that we use to gauge how crime is going, and those other statistical things that we look at tell us that really we haven't had very significant changes one way or another. Our crime rates remain relatively constant, but I would caution, as we mentioned back in 2022, it will not really be possible to compare NIBRS data to UCR data, and there's 2 reasons for that. One, they're capturing crime statistics on a tenfold number of crimes from before. And the more important thing is that one of the main features of NIBRS is that it captures data on every crime committed in a particular incident. Previously, UCR would capture the data for statistical purposes on only the most serious crime. So in other words, if someone broke into a house, stole an item with force, and then stabbed the homeowner, you would have both a burglary, a robbery, and an aggravated assault. UCR would have only counted one of those crimes. NIBRS will count all 3. So it may appear when we report out on the NIBRS statistics that certain crimes are increasing if you compare them to our old UCR statistics, but I think it's going to be more due to the fact that they're just now counting each and everything that happens in a particular incident. I have, joined by Deputy Director Judy Tirico from our Bureau of Technical Services. I have a pretty good grasp on this, but she is the expert, and when I'm done here, if you have additional technical questions about NIBRS, she'll be able to answer those for you. The Police Department Redistricting Project. So this project it is on track, should be completed on schedule. We worked with the Matrix consultant company to gather and analyze data on a number of facets of the department's operations, and we want to ensure that the district boundaries are drawn to the most efficient method possible. But in addition, this study didn't just look at the boundaries of our geographical patrol districts, but it looked at a variety of different areas of the police department in order to try to increase our efficiency. In early part of this year, in January and February, the Matrix held a series of meetings in every city council district to gather feedback from the community on the proposed boundaries and what the community wants to see from their police department. And this feedback was used by Matrix to refine the maps and ensure that the deployment models do meet the needs of the community. Project could result in some pretty significant changes in the department, depending on how the recommendations look and how we feel about the feasibility of implementing them. We should be receiving the final report on this redistricting project from Matrix in May of this year, at which point we'll do a cost analysis of the proposed changes, report back to you, to the full council on this plan, and then make any necessary budget requests. Should give us a pretty good blueprint of how we need to move forward. Let me talk about a little bit of the data that was used by the Matrix group. They looked at current and historical response times, current and historical crime data, current and historical workloads per geographic patrol district, current and historical staffing levels throughout the department, as well as within different units in the department. We looked at the current and historical performance measures, audits and police department evaluations, industry standards, best practices at other law enforcement agencies. We did, as I mentioned, the interviews with various stakeholders. The Matrix folks did ride-alongs with our patrol officers, sit-alongs with our dispatchers, and again, we got the community input through the meetings and surveys. There's a lot of different factors that they're considering when changing district boundaries. We look at our current patrol geographic boundaries. We have your council district boundaries, geographic characteristics, in other words, sort of the topography of these districts, the population demographics in each district, the density, the traffic loads, the technology and equipment, and by that I mean a lot of our radio traffic is dependent upon where we've placed different radio repeaters and stuff throughout the city. The technology and equipment that we have and that we might need to go to a different district boundaries, our staffing levels where we hope to be, span of control, meaning how many officers is each sergeant in charge of supervising, the call volume per district, and then also the call severity, the types of calls. The things that they looked at, like I mentioned, it's not just, it's called a redistricting study, but it's looking at not just the district boundaries for our 16 patrol districts, but it's our overall staffing, span of control. They looked at different scheduling models for the department, deployment throughout the department, the equipment that we have, the technology that we currently have and could need. Again, it looked at patrol, community service officers, our special operations division, and our communications division. Just a quick timeline here. We signed the contract with Matrix in April of 2023. In May of 2023, they began data collection and interviewing people throughout the department, including myself. The community engagement piece began in November of last year. We received a first draft in January. Second draft was just received this month, and as I mentioned, we should be presenting to you in May on the final draft and its results. And I think this slide is pretty redundant, so I'm going to move on. All right, illegal gaming in San Jose, a topic of some discussion. So there's three features of what constitutes an illegal gambling device per the penal code. It's a machine, apparatus, or device in which something of value is given to play on that device, and the player has the opportunity to receive something of value in return. We typically find illegal gambling operations in one of two places, either in a private residence or in a business of some type. And the businesses could be of any kind, often hair salons, bars, laundromats, but we have found them in auto repair industrial parks, if you will, often in remote locations where people hope not to be discovered. And quite often we are either discovering them through complaints from the public, or our officers respond to some sort of other call for service and are able to determine that it is in fact an illegal gambling operation that's working in that location. The only authorized card rooms, the only legal gambling in the city of San Jose is the Matrix Club and the Bay 101 Club. Any other casino or card room in San Jose is illegal. The Vice Unit, Street Crimes Unit, and the Metro Unit investigate illegal casinos. Currently, our Vice unit is working to centralize all casino investigations there and working to bring in other city resources when we do have an illegal casino in operation. In other words, work with code enforcement, planning, the city attorney's office to do things beyond simply arresting the people involved in the operation. These illegal casino operations often contain weapons. There's often a lot of violent fugitives and other criminal activity, including human trafficking and drugs and stolen property that we recover when we encounter one of these illegal casinos. Currently, there are 7 ongoing investigations. We've served 4 search warrants on 4 different locations already. 4 of those cases are being worked by our street crimes unit, 2 by Metro, 1 was begun by Patrol. One of our biggest success stories in December, we recovered 33 firearms, 15,000 rounds of ammunition, 500 pounds of marijuana, and made 5 arrests during that takedown. So I bring up the point about the weapons and the drugs and whatnot because I think some people consider gambling to be sort of a victimless crime, but there is a lot of associated illegal activity that goes with it that does present public safety hazards. So with that, we're here to answer any questions you may have.
Okay, thank you. We'll go to public comment first.
There is no public comment.
So no public comment. We'll bring it back to the committee. Let's see, oh, there it is. Okay. We'll go to Vice Mayor Kamei.
Thank you so much, and thank you so much for your work. I know that it is quite a huge job. I'm delighted that your information and data system is moving along and is going to really provide a lot more information, and yes, it may be a little bit more information, but I think that's going to be okay because it gives us a better picture of what is actually happening. So I'm very supportive of that, as well as, you know, I think it's going to give us some new learnings as we move along. So thank you so much for that. In terms of the other activities, I know that, you know, there's been sort of, in some areas, an uptick on some of these activities. So as you're moving along, I know we've gotten a couple of complaints about the sale of marijuana in many different sort of areas that they're not supposed to be. And so I want to thank you for your diligence and constantly, you know, trying to work with others and the community and keeping on it. So thank you so much. And I would like to make a motion to accept the status report.
We have a motion and a second. We'll go to Councilmember Batra.
Thank you very much for that, the switchover of the data, which I've seen happening from the beginning of I've been here. I think first quarter after I was here, Captain Donahue presented me with the newer type of data, and as a result, yes, the same, what used to be counted as 1 crime, the highest level, could be 2 or 3 crimes. So on the surface, it can look that the things have gone worse, but actually it is really just expanding on what was hidden under the previous system, okay? So I appreciate that transparency. Actually, it gives you better tools to actually manage what problem levels need to be addressed. So, and I thank all the uniform officers who put their life on the line every day for the safety of the community. So thank you very much for that work. You made one comment about that the casinos could look like a victimless crime. I made a comment yesterday or Tuesday that homelessness is not a crime, but homeless encampments can become the sites or could encourage the criminal activities. And I don't know if we are allowed to or you're allowed to legally patrol those places proactively and see nothing of that kind of a activity developing there, rather than waiting for an activity to develop and then be told by somebody and then you go and investigate. I was curious about knowing that because I do have a complaint in my district I have received.
I'm sorry, Councilmember, regarding locations that potentially have illegal casinos or locations with homelessness?
In encampment areas where the homeless people are living, are you proactively allowed to do patrolling in that?
Sure. Well, we can patrol anywhere we're legally entitled to be, which would include public lands on which there are homeless camps. Obviously there's a lot of those, and we do our best to be in them. We respond to any call for service at a homeless camp. We do sometimes have investigations that will take us to an encampment because that's where the leads bring us. But I wouldn't, I wouldn't say that. I would like to say that we were patrolling freely all over the city more than our staffing really allows us to do, but we certainly do our best to patrol in those locations when we can.
If I can jump in too, especially when some of those encampments get to be so large or we are aware of illegal activity, those do get prioritized for outreach very quickly, and they do get prioritized through abatement so that we can deal with any illegal activity in the unsafe environment that they are in. But that it's not because of any proactive kind of patrol, it's really through the outreach efforts that when it reaches a certain level, we take more aggressive action.
Okay, all right. Thank you.
Thank you, Councilmember.
Thank you.
Okay, we have Councilmember Dwan.
Thank you, Vice. Thank you for the report there, Chief and Lieutenant. How many personnel do you have in Vice in order to address some of these illegal gambling and so on?
Currently, we have one sergeant and one officer full-time assigned to Vice.
And would you agree with the fact that we do have a huge problem of illegal gambling here in the city of San Jose?
It's hard to quantify because we don't know about them until we learn of them. As I mentioned, we do have 7 active investigations going at the moment. It would be great to be able to devote more resources to that and many other issues in the city.
Well, I've got some intel for you. Right down on Tully Avenue and a lot of the different coffee shop that stay up late at night, and there's a lot of illegal activity, so hopefully we can keep an eye on them as well. Now, I know that you guys are doing an incredible job with less than 1,100 police officers. And I remember that in 2008, we have above, I believe it's 1,450 officers. As a population have risen, I believe somewhere we should be at about 2,000 officers to have enough officers to investigate, to catch criminal, to many other areas. What are your estimations for us to even meet that goal, and how long would it take?
Well, I would love to have 2,000 officers in the San Jose Police Department. I mean, we are dealing with the same issues with recruitment and retention of police officers that are really nationwide. Those issues, fortunately, are changing in our favor, slowly but surely. Our numbers of applications that we're receiving are increasing. The numbers of people attending each academy are increasing slowly. The council here and the city manager's office has been very supportive of bringing more folks on board. I wish we had every budgeted vacancy in the police department filled, and we're doing everything possible to make that happen. But it's really hard to say what the future looks like for law enforcement. We want more outreach to our younger folks to get people to consider law enforcement as a career. It hasn't been something that has been very appealing in the last few years, but as I say, that is changing for the better in our favor. So it'd be hard for me to estimate how long it would take us to get to 2,000. You know, the other thing to remember too is we want to bring on board quality individuals to be San Jose police officers, and anytime you grow too quickly, you run the risk of possibly making mistakes and hiring folks that you wish you hadn't ultimately. So we're going to always make sure that we're keeping our standards high, that we're careful, that we're selecting only the best from our applicants, and we will grow at the rate at which it's possible.
Thank you. I totally agree with you. We should have more qualitative versus quantitative. But on the other hand, we're short of a lot of services from the police department as well. And I remember in 2008 in Measure B, I told residents back then it will take us 20 plus years before we get back to 1,450 officers. So we'll continue to support. We'll continue to find a way to have better recruitment and retention as well. I say thank you for your incredible work. Every men and women out there who risk their life every day to protect us. Thank you.
Thank you, Council Member.
Seeing no more comments, I think we'll go ahead and vote to accept the report. Okay, seems like it's unanimous.
That passes unanimously.
Wonderful. Thank you so much for the report. Appreciate it. All right, I think we're down. That was our last item. We're at open forum. We have any public comment?
We have no public comment.
Okay. All right. Meeting's adjourned. Everyone have a great rest of the week.